All right. And good evening, everyone, and welcome. This is the Health and Human Services Board meeting for November 11th, 2020. And before I call the meeting to order, I would like to, if you don't mind, folks, I'd like to give a short shout out to all our veterans today. You folks are the bravest and the very best. And we thank each one of you for your service. Thank you. This is the Health and Human Services Board meeting for November 11th, 2020. Before I call the meeting to order, I would like to, if you don't mind, folks, I'd like to give a short shout out to all our veterans today. You folks are the bravest and the very best. We thank each one of you for your service. Thank you. This is the Health and Human Services Board meeting for November 11th, 2020. With that, I'll call the meeting to order. Colleen, you want to give us a roll call, please?
Kathy Lee?
Present.
Can you hear me?
Meeting to order. Colleen, you want to give us a roll call, please?
There's bad sound.
Kathy Lee?
I'm present. It's like
Tara Koch?
She's excused.
Dave Osmus?
Here.
Scotty Ard?
Present.
Greg Calijon?
Bad sound.
Paulette Anderson?
Present.
Deb Lindeman? Tara Koch?
She's excused.
Dave Osmus?
Here.
Scotty Ard? Natasha Ward? Greg Calijon? Paul McGinnis?
Present.
Paulette Anderson?
Present.
Mr. Chair,
Yes, go ahead.
I thought I would just mention that there's been some concerns about the accessibility of this meeting this evening and with regard to participation of the public in terms of public comment. First, there is no right under the Wisconsin statutes for a citizen to present public comment as an absolute right. Boards can decide the manner and the method in which public comment is received. This evening, the board and the board chair has decided to receive public comment via either Zoom or telephone, because we are in these trying times of COVID where there's rapid transmission of the virus. And in order to keep the public, staff, and the board members safe and healthy, the board chair has elected to do that. Furthermore, under our own board rules, a committee of the board does not have to have public comment. But this board chair has elected to do so. And under those rules, the board chair can also limit the time period for public comment. Now, with regard to the accessibility of the meeting is able to be viewed in the county boardroom. The government center is open. Viewing is also possible via the county website. And participation is also allowed by public comment on Zoom, and I understand that on Zoom and telephone. So this meeting meets all the accessibility requirements of the Wisconsin statutes, especially in light of these special times of the COVID-19 virus. They are consistent with the guidelines that were set forth by the Attorney General in March of this year. So I believe the meeting is compliant with respect to the open meetings law. Thank you.
Okay, and thank you, Scott. Before we get into public comment, just a little bit of a time frame and how we got to where we are, folks. On September 8th, the HHS subcommittee recommended that the HHS board consider version 3 of the communicable disease ordinance at the September 16th board meeting. And this meeting was canceled due to safety concerns for everyone in attendance and to prevent further spread of COVID. On September 19th, the rescheduled HHS board meeting was held to discuss budget items only, and the ordinance was not discussed at that meeting. On October 7th, a digital town hall was held to provide a safer online option for St. Croix County residents to provide comment and ask questions. And at that time, I believe there was 2.5 hours of comments and questions that were asked. On October 14th, after discussion, the HHS subcommittee voted to postpone indefinitely their recommendation of version 3 of the communicable disease ordinance for consideration by the HHS board. And then on October 21st, during the request for future agenda items portion of the board meeting, a request was made to put a version of a communicable disease ordinance on the agenda for the next HHS board meeting. And this is a separate version from version 3 that we looked at before. And that brings us to where we are tonight. So part of the review process of an ordinance is added, or when added, and has been added to the HHS board meeting, the board would consider the ordinance and decide whether or not to recommend the ordinance to the full county board, amend the language of the ordinance, or to postpone a decision to allow for further discussion. And if approved by the HHS board tonight, it will be added for consideration at our next St. Croix County Board of Supervisors in December. And the full county board would then consider the ordinance and choose whether or not to adopt the ordinance, amend the language of the ordinance, or postpone it. And if adopted, the ordinance would be in effect upon publication. So that brings us to where we are tonight. There were no minutes to approve, so we will skip those. I'm going to allow 1 hour for public comment. And Ken, if you want to get us started, please.
Thank you, Chair Osnes. We have 101 people on the meeting tonight online, and I have 25 people. The first one up is Bob Long.
Good afternoon. Can you hear me?
Yes, go ahead, Mr. Long.
Okay, thank you, Ken. Thank you, Mr. Chairman. Bob Long, County Supervisor, District 3, including the wards from Town of Hudson and Town of St. Joe. First, I want to say that I believe our public health officials have been doing a great job during these extremely challenging circumstances. So I commend Kelly and her crew and thank them for their dedication and their hard work. That's important. Secondly, I also believe that the intentions of this board to protect public health are sincere. I know you feel like you need to do something, and I appreciate that. Supervisor Telejohn, I think, said it best recently, expressing the desire to provide some form of leadership. And I think that's really important. So let me talk briefly about the proposed ordinance strictly from a practical standpoint. Okay, here's the problem. You're trying to enforce behavior on citizens that, for the most part, likely won't comply. So basically, it won't work. It won't accomplish what it is that you're trying to accomplish. More than likely, it'll create confusion, division, and a lot of ill will. And that's actually the opposite of leadership. So leadership in this context, I believe, is educating and motivating citizens to act together toward achieving a common goal. Enforcing their behavior against their will simply won't work. So here's my suggestion for what it's worth. So agree on the language of the ordinance, table it. Turn your attention and focus to ways of providing leadership, how to better educate and engage the public and try to understand their reluctance to your approach. So in short, I'm encouraging you to be leaders rather than enforcers. Thank you so much for the opportunity to speak.
Next up, we have Darla Myers up next. I know Darla's in the county boardroom. She needs just a minute. They're going to move out into the hallway when they speak. Otherwise, we'd get feedback in there.
Hi, this is Darla Myers. I'm speaking as a citizen and not a Town of St. Joseph supervisor. I'm going to read the last half of the Wisconsin Manufacturers and Commerce letter that you should have all received. The county's ordinance goes far beyond the statutory authority given to local health officers in Wisconsin Statutes 252.03. Any attempt by the county to draw authority for their local health officer to issue orders of general application from the broad and vague language in that site cannot succeed because the statute grants narrow, specific powers to local health officials. These more specific powers include invest on the health conditions to the state, report on health conditions to the state, inspect schools and other public buildings to determine if they are in sanitary condition. The statute's broad language must be read together with a more narrow text. In order to avoid surplusage, the general grant of authority cannot be so broad as to swallow up these narrow actions by the public health officials. The county's reading of the statute would do just that and therefore is likely not a valid interpretation of the law. Further, the authority the county believes it can confer upon unelected, unaccountable local bureaucratic officials is substantively the same as the authority that the Wisconsin Supreme Court ruled the State Department of Health Services did not have. Specifically, the order recreates capacity restrictions, limitations on public gatherings, and distinction between essential and non-essential businesses. In the interest of time, I'm going to skip to the last paragraph. The county's ordinance is both legally suspect and bad public policy that will simply create confusion, uncertainty, and fear, which will negatively impact local employers, workers, and customers. WMC encourages the county to provide certainty to its residents by ensuring that any ordinance related to protecting the public health is clearly within the bounds of state law. WMC respectfully requests the county board to vote down the ordinance and start from scratch. Thank you.
All right, next up is Jessica Klatt.
Hi guys, this is Jessica Klatt from Hammond, Wisconsin. So tonight I want to talk about a few statements that I've been receiving from some of our frontline healthcare workers. Many of the people that reach out to me are scared to speak publicly for fear of losing their jobs. And as you know, we desperately need to have our frontline workers. So here's some bullet points that I was asked to share with you guys this evening. From one nurse in St. Croix County, my COVID-19 patients are generally not afraid of the disease. I'm seeing much more damage done by being isolated alone in a room than the disease itself. The big story today, this was the other day, in the news was the vaccine by Pfizer. This has become so political that no one wanted to talk about it. Even Dr. Fauci predicted it would be the most likely be available at the end of 2020. As a registered nurse in a St. Croix County hospital, I take care of 4 to 6 positive COVID patients at a time, safely. Last spring, I could only take care of 2. We have better treatments and outcomes, plus we are becoming more efficient. This week, we will have rapid testing available, 45 minutes, to test in our hospitals so we can free up beds in a COVID-19 and triage appropriately. This is a huge step towards more capacity. Patients that have complex medical histories are recovering faster, even patients that are on chronic oxygen at home. We now have adequate supplies of N95s and other PPE for staff. We've been planning for a COVID surge since last winter. Hospital management has a good plan if we need more beds than current capacity. They don't share that with the public. I have been training nurses to assist me since last spring. I always ask my patients where they think they got infected. They rarely know and are very surprised they even got it. They rarely go out other than the grocery store because of their fears and weakened immune systems. Some patients of mine believe that they were infected out of the county. An ordinance is not going to stop that. I'm going to ask you guys once again, please withdraw formally. Thank you.
Hold on just a second. Sarah Blegan is up next. I hit the wrong button. I got to find her on the list now. All right, Sarah, you were up.
Okay, I'm walking out to the hall. All right, can you guys hear me?
Yep, go ahead.
Okay, Chair Osnes, thank you for allowing us to speak today and attending this meeting in person. Today, we honor those who have sacrificed so much for our freedoms. As they have given of themselves, we too stand by them now. They fought and bled to defend our country and our Constitution, and so today we also take up that mantle. We thank them by telling them we have not forgotten. We do not take for granted our freedoms. Board members are held to an oath which states, I will support the Constitution of the United States and the Constitution of the State of Wisconsin, and to faithfully and impartially discharge the duties of said office to the best of my ability. So help me God. Kathy Leaf, Greg Telejohn, Scott Cox, Paul McGinnis, and members of the board attempting to break your oaths of office and rob us of those freedoms, let me explain something to you. You thought you were dealing with milquetoast conservatives and rhino Republicans, but you were mistaken. You have woken the patriots. Patriots are fueled by a fire inside and to defend and protect freedom. We seek truth and liberty. We are not motivated by greed or money, and as such, we will not stand for those who are. We, the people, demand a government of the people, by the people, and for the people. Since most of you will not face us in person, I want you to hear something. I now yield my remaining time to the assembly of patriots gathered here today as we, the people.
Shut him off.
Ken, do we have anybody else online?
And that was 2 minutes.
Yep, we do. All right, so we have up next John Doe.
Can you hear me all right?
Yep, go ahead.
This is Brandon Wallen. The name on there is Don't Tread on Me, not John Doe. I, along with thousands of others, oppose not only this ordinance, but also your persistence to push this through after being met with overwhelming disapproval every single time it's on the agenda. We've all learned about the behind the scenes conversations you've been having to try to scheme yourselves into additional power. We'd all like to inform you that you're in those positions because we, as residents, haven't paid close enough attention. That has changed. It would be in your best interest to listen to constituents if you like your role serving St. Croix County, because we're ready to start replacing all of you. If you think messing with our freedoms is some kind of a game, get rid of the ordinance and start serving instead of ruling. That's all.
All right, up next is Linda Savla. Linda, are you there? All right, I'm going to move on to the next one. All right, Darla, you're up next.
My name is Beth Weiskopf, Hudson, Wisconsin. I'm going to continue talking from the Wisconsin Manufacturers and Commerce Statement. WMC understands and appreciates the public health concerns revolving around the COVID-19 pandemic. Indeed, WMC has been in constant contact with our members and the business community at large to operate in a safe and responsible manner that protects both their employees and customers. WMC believes this education, rather than unlawful regulatory mandates, including this ordinance, is the best way to collaboratively move forward and slow the spread of COVID-19. To begin, the county has cited no statute authorizing it to adopt this ordinance. A county is a creature of the legislature, and as such, it has only those powers that the legislature by statute provided. Jackson County versus State, Department of Natural Resources, 2006, Wisconsin 96. 16. Thus, a county board must have a statutory source upon which the power it exercises is based. State, example, relative to Tennis versus Kenosha City, 142, Wisconsin 2D 498, 503 to 04, 1988. Here, the county has invoked only Wisconsin Statute 252.03 and 252.25. Neither of these statutes permit counties to expand the powers and duties of their local health officers. Wisconsin Statute 252.03 spells out local health officers' duties. It does not empower counties to augment them. Similarly, Section 252.25 allows for a local unit of government to penalize individuals for violating valid local ordinances, which the county's ordinance is not. The section does not provide authority to the county to create the ordinance itself. The county cannot claim Wisconsin Statute 252.03 as its source of authority to expand the power of local health officers, because the statute does not give the county any authority to transfer lawmaking power to these officers. See Wisconsin Carry Inc. v. City of Madison, 2017, Wisconsin 19, 2328. Wisconsin Statute 252.03 does not provide any authority to local legislative bodies, such as the ability for county board of supervisors
That's 2 minutes.
to pass an ordinance giving the local health.
Thank you for that, Beth. All right, Debbie Mannon is up next.
Hello, can you hear me?
Yes, go ahead.
Okay, thank you to the board for allowing me to voice my concerns and ideas. I am Debbie Mannon from Wilson. I am very much against this proposed ordinance. We are a constitutional republic. If you decide to go through with this ordinance, then I feel we, the people, should have a chance to vote on this. Put it to the people of St. Croix County and allow our voices to be heard. Let us vote on it. If it should pass, then allow we, the people, to vote on this person. This position of authority should be an elected position, not someone you, the board, decides to fill the spot. Please allow the voice of we, the people, to be heard. My question to you is, will you allow we, the people, to vote on this?
All right, thank you, Debbie. All right, John Salmi, you are up next.
Stand by. Let me get out into a quiet location. My name is John Salmi. I live in North Hudson, Wisconsin. And first, I want to thank you for allowing us to speak. Listening to the constituents carries weight. So for that, I thank you. I've been the guy that stood in front of you a few times and rattled off numbers. I was going to do that today, but today I'm just going to stick to St. Croix prior to this afternoon's update when some of the data was unavailable. Total tests as of this morning, 26,509. Total positives, 2,913. Total deaths, 16. The death rate as a percentage of positive tests, 0.5%. The mortality rate of St. Croix County population, 0.01%. With that said, all this insanity has been driven by the case numbers. The case numbers have been driven by, I believe, PCR testing. After doing some homework on PCR testing, there is some doubt which should be cast upon this thing. I was looking at a document today called the CDC 2019 Novel Coronavirus Real-Time RT-PCR Diagnostic Panel. On page 35, this document discusses the RNase P reaction, which crosses a threshold line with 40 cycles. 40 cycles. There are 5 references on this page to 40 cycles. On July 17th, our buddy Dr. Fauci said in an interview with This Week in Virology that anything beyond 36, you got to, you say 36, 37, 38 cycles, it's just dead nucleotides, period. That calls into question, what is this test checking for? A question I've got is, has this virus actually been isolated? If so, I'd love to see some real proof. Dr. M, if you've got proof, you have my email address. I sent you some mail earlier today. Please respond. Also, on page 39 of this document, it states no quantified virus isolates of the 2019 nCoV are currently. That's 2 minutes. Thank you.
Thank you, John. I appreciate that. All right, up next is Liz Horning.
Thank you. My name is Nick Horning. I'm from the township of Hudson. So I'm here to speak to you as a youth. How is this affecting my life? I'm 16 years old. I go to Hudson High School, and we have to wear masks every day. And if I had to wear a mask every day, every second, every day, outside my home, it would be crazy for me and my peers, because we don't have the luxury of growing up in a normal reality and having this as a actual reality, having this as this is what our lives could be, is impacting us in ways that's hard to imagine for adults. Imagine being isolated all the time from your friends, not be able to go out and hang out. We're young. We don't have full-time jobs where we don't get to do that as adults. We get to see people every day at school, but we're talking through plexiglass like it's prison. School, I used to love going to school. I was competing for top of my class. I used to love going in to see teachers and talk with my peers, but now it's like I dread going in because it's not the same place that I love to go to. Now it's a prison that I'm muzzled for my opinions against this ordinance, and I'm muzzled against believing that this is wrong. And that's what this ordinance is, a muzzle on the people of St. Croix County who are here tonight telling you this is wrong. And you guys need to hear that. You hear how wrong this is for you to do to the people here. That's all I have to say.
All right. All right, he dropped off right away. Confused me for a sec. All right. Rachel McCardle, you are up next. Rachel, are you there?
Yep, I'm here.
All right,
Can you
go
hear me?
ahead. Yes, go ahead.
My name is Rachel McCardle. I live in Hudson here, and I oppose the COVID-19 communicable disease ordinance. I'd like to give you insight into my life. During the statewide shutdown, my family was out of work for almost 2 months. We didn't qualify for grants. We didn't qualify for loans. Our right to work was taken away from us, and we were left to fend for ourselves. It was a terrifying place to be as a young mother who was also expecting. This ordinance will again take away my say and very likely impact my family's income, our lives, and our rights. My question is, what is St. Croix County going to do to help my family and families like mine if you are to shut us down? My family and many others do not want to rely on the county when we are able bodies and we can and should be providing for ourselves. That is, if the county has any aid to provide us. The state couldn't, so I'm not sure if you can provide that. Guidelines and suggestions are okay, but medical mandates are absolutely crossing the line. Again, this is one size fits all medicine being forced on a population of people. Medicine should be individualized. Let us have a voice. Please oppose this ordinance and please formally withdraw this ordinance. Thank you.
All right, Brandon Kay, you are up next.
Everybody hear me?
Yep, go ahead.
Brandon Kojal, Somerset, Wisconsin. So once again, I'm here to voice my opposition to this ordinance. I speak on behalf of many others when I say we don't know how many times we have to say it. There's been a lot of talk about this being a partisan issue. If it was partisan, you could claim that 57% of voters in St. Croix County would likely be opposed to this based on 2020 voter data. We just want you to listen to the residents. There's been a new layer introduced to this topic. Some dedicated people went through the process of an open records request, and now information is all over the internet for us to see. Quite frankly, we're appalled. It's clear to us that some of you are spending more time trying to finesse people into giving you their vote than you're doing actually thinking about the content of this ordinance. I personally reached out to, I think, 8 or 9 different friends of mine in St. Croix County that are well-known and respected business owners, and not a single one of them is in favor of your capacity limits. A few of them referenced the first 60% or so of their revenue goes to overhead and staff. How are they supposed to break that threshold with you limiting their businesses? It's no wonder you were having so much trouble finding business owners to speak in favor of your ordinance. Yes, we saw that email too. What business owner can afford to survive right now in general, much less with your additional attacks on their livelihoods? We're asking you to vote to kill this ordinance. We're tired of having to fight for freedom in a country that's supposed to be built on it. Thank you.
Thank you, Brandon. All right, we have Matt up next.
Can you hear me?
Yep, we can. Go ahead, Matt.
Thank you, sir. Thanks for your time. My name is Matt Hansen, a resident of Somerset, but I am speaking to you today on behalf of a business operator in Hudson. There's a tremendous amount of very educated, intelligent people here now and before that will speak to you on various numbers of points and issues. Frankly, I'm too involved every day trying to keep our small business in Hudson afloat to spend all my time trying to fight against a small amount of you trying to push this through. Today, the point I want to make is this: your purpose and intent written in this ordinance to promote and protect the public health, safety, and general welfare of the people and community of St. Croix County. We are not asking for this when it comes to COVID-19. Quite frankly, the ordinance you are proposing directly goes against the very thing you are seeking, creating damage that you continue to turn a blind eye to. I'm not going to talk about the effectiveness of masks. I'm not going to make this a mask issue. For every one doctor, scientist, epidemiologist you choose to present or listen to, there's another the same opposing or refuting the exact same points of effectiveness with proven data and scenarios. The mask mandate is irrelevant at this point, and frankly, we are just as sick about talking about as you are continually having us be here opposing you. Most importantly, our businesses are hurting severely. The fear that is falsely being pushed and shoved down our throats every day by the media, our national government, and now local elected officials about this virus is and has been completely out of control. It's clear anyone in favor of this ordinance have all succumbed to it as well. If your information from the health department is so accurate and trustworthy, if your faith in our current testing systems is so great, and if your tracing ability is so effective, then there is no reason why this governing body can't be extremely precise and exact on pinpointing how to lower cases and actually help and save the people that actually require it, instead of enforcing a blanket ordinance over the entire community that affect all things with little specifics and clarity, when in reality, every single number you're provided with is highly questionable and suspect. Your job as elected officials is to represent us. Quite frankly, whatever your personal feelings and emotions are, not only about this virus, but any governing situation you come across is irrelevant. You weren't voted into office because you're smarter, more qualified, or have access to anything that any of us don't have. Your duty is to represent us, our voices, what we want. You were elected to be our voice, and for months now, the overwhelming voices being heard have been against this ordinance.
Thank you, Matt. I'm going to cut you off there. Sorry about that, but trying to keep to the 2-minute limit. All right, up next we have Lynn Betzold. Lynn, go ahead.
Hi, can you hear me okay?
Yes, and we can.
Okay. I am here to represent the Amos A. Miller. He is the bishop of the 48 families from Woodville and Baldwin. He wanted to be sure, dated today, November 11th of 2020. And he says to the lords of the land, we as an Amish community are still opposed to the new ordinance that is being proposed to the county. And Lynn Betzold is speaking for us. We pray again you would listen to the voice of the people. Thank you.
Thank you, Lynn. All right, Angelica.
Okay, can you hear me?
Yes, we can. Go ahead.
Okay, thank you. Dave, I'd like to thank you for letting there be public comment tonight. Clearly there is a vast majority against. We haven't heard anyone for, and I want you guys to listen to us. I think the crux of it for me is that the state orders, as well as this ordinance, which this ordinance is drafted after the state orders, they do restrict freedom. They restrict public gatherings, our ability to interact with each other, read facial expressions, gather with loved ones, on and on and on, even our kids' ability to attend school. I want to ask you guys, these freedoms should only be restricted when absolutely necessary. And viruses vary widely in fatality. For example, you have smallpox at an approximate 30% mortality rate, and then influenza at a 0.1%. I want to ask each of you, what infection fatality rate would you say is that point at which government should take over our lives and pass an ordinance of this nature?
All right, M. Shaw, you are up next.
Hello.
Yep, go ahead.
Well, thank you for allowing me to speak tonight. This is twice that I haven't been able to speak, so this makes 3 attempts. I feel that maybe 6 minutes should be in order. We are spending hours and hours and hours and hours of our time. We're taking time away from our families. We're taking time away from work. We're taking time away from our veterans. These veterans have much more to lose than we do. We're talking about freedoms this evening. So that you're aware, 22 veterans every day of the week throughout the year in this country commit suicide on account of serving this country. To the veterans, I say thank you. And to Scott Cox, I say, take a Constitution Alive class. It's very enlightening. It's put on with Rick Green and David Barton. I think it could be very informative. We have young people within this county that are taking this class, and they now know more than you, Mr. Cox. I am appalled by the attempt of this committee to continue to change the rules of the game in the middle of the game and do it with such a pompous attitude. Dr. McGinnis, you are an unelected official, and we do not appreciate your one heavy-handed approach. And to everybody else on this committee, including the gentleman sitting all the way across a room that nobody can even see your face, you might call this a legal meeting. This is a joke. Thank you.
All right, Sarah Yakub, you are up next.
Hello, everyone. Sarah Yakub, resident of Hudson. I want to thank you for hearing us tonight. You know, we all should be on the same team here. It's a tragedy that this pandemic has been politicized, but this is not something that's going to go away until we buckle down. The irony here is that nobody wants to shut down, and this ordinance actually helps keep our economy open. Somebody mentioned the activated patriots or the Republicans that oppose this. You know, the irony is rich. The party of law and order is vocally refusing to comply, threatening anarchy. The party of personal responsibility is refusing to abide by CDC guidelines. We have local leaders, elected officials who run their businesses without wearing a mask, who are contributing to the spread of this virus. So yes, you know, we should all be responsible, but what we've seen is we haven't. People didn't use the freedoms to simply go to work and to school. They packed the bars. They packed political events. You know, we have laws against drinking and driving, laws that require us to wear seatbelts. By the rationale of, I'm going to call you bullies because that's absolutely what you are, the bullies who are opposing this and threatening people and demeaning people who disagree with you. By your logic, seatbelt laws are, you know, an attack on our freedom. We should all be able to drink and drive. We live in a community, and I commend the board for shouldering this. I disagree with Bob Long. Leadership is doing the right thing, not what's socially convenient, not succumbing to the will of bullies, again, because that's what we're dealing with here. Please stand strong. Please listen to the constitutional scholars, not online legal experts, but people who went to law school, the medical experts. I know you're working hard for us, and I thank you, and I'm so sorry for the treatment that you continue to get from people who think they—
That's 2 minutes.
Thank you.
All right, Sarah Bachland is up next.
Can you guys hear me?
Yes.
Yes, go ahead.
All right. Lynn, I don't know if you guys can hear me. Sarah Bachland, 573 Omaha Road. Thank you. I stand in opposition to this ordinance. I'd like to point out that it's too bad that you're not here in person to hear from your constituents face to face, to see our facial expressions and to read our body language. Do you even know that we can see your faces during this meeting? We can see that you are working on your computers. We can see your eyes scanning the screens. We can see you fiddling through your paperwork. You are not listening. You don't answer our phone calls. You don't respond to our emails. Please explain to me how you are representing your constituents. Do we need to keep on reminding you that you work for us? You get to vote as you want tonight. And though I hope you vote to represent us, I doubt that you will. I assume that you will succumb to the pressure you are getting from the ones trying to run this show behind the scenes. To those of you working behind the scenes to ruin the show, Kathy Leaf, Greg Telejohn, Paul McGinnis, Scott Cox, you have lied, cheated, performed illegal acts, coerced board members to concede to your agenda, and seemingly will do anything to try to pass this ordinance. We the people are done with this overreach. A virus will run its course. That's Virology 101. Now I know your argument is that we need to have something in place to stop the spread of this virus, and that we need to keep on testing to track it. Your efforts are futile and frankly a huge waste of time and taxpayers' money. Your efforts and resources would be much better spent investing in promoting healthy living and supporting those who are suffering the side effects of COVID-19 restrictions. That brings me to my last point. Citizens of St. Croix County, please hear me when I say that we do not need to vote these supervisors back in office. Take note who votes this through. I have maps of each of your districts. We will take your district maps, and I will go door to door telling everyone what you have done for the last months, the lies, your deceit, and how you voted today for government overreach. I am working to find solid
That's 2 minutes.
against each of you, and I will work endlessly providing financial support.
Thank you, Sarah. Michelle, you were up next.
Okay.
Go ahead, Michelle.
Can you hear me?
Yes, we can.
All right. There are questions that our county health officials seem unable or unwilling to answer. Wait, I just need to first comment that Sarah Jacob needs to take a constitutional class as well. We request the viral load cycle threshold of all previous, current, and future positive cases in our county, rather than simply positive or negative results. This would help those who receive a positive test result to know if they're infectious or not. I believe the labs being used by our county hospitals are Mayo Clinic, Quest Lab, and Exact Science. These labs need to provide enough information so we can establish which tests reflect an actual positive, potentially contagious COVID case with a live virus. We ask that our county and hospital facilities demand transparency from the labs providing this information, and we demand transparency to the public. I believe that all the people who have passed away in our county may have had additional underlying medical conditions. It is terribly sad when anyone passes away, but we ask for transparency of our county with this information to stop the fear that they instill with their narrative and numbers. This type of data would be extremely helpful rather than the blanket numbers they provide. We understand confidentiality of patients, but if you are going to give us county statistics, we demand transparency as to the circumstances and data of each death, so we can know the risk to the general population. The CDC seems to be providing this information. Why can't our county do so? Certain board members would have us to believe that this pathway to zero metric is an effective pathway. However, it puts us immediately into the arbitrary red zone and provides us little hope of ever obtaining the green zone. They're using unproven metrics to potentially destroy the economy of our county, businesses, and even individual lives. Please table this ordinance permanently.
Thank you, Michelle. Up next, we have Celeste Kuburl.
Hello, this is Celeste Cabral. Can you hear me?
Yes, go ahead, Celeste.
Okay. Like Marion Shaw, I have spent hours and hours and hours advocating since May for our county and other local units of government to adopt mandatory and enforceable public health protections against COVID-19 exposure and spread risks in our community. Unlike Marion, I actually have done some research. And unlike Marion, I actually am an attorney and can say, as your county council has pointed out, that you are well within the authority of the state law and the U.S. constitutional law to impose mandatory and enforceable public health protections. There is no liberty under our Constitution to make choices about one's own health that endanger the health of others. We should allow professionals with appropriate public health expertise to make decisions about public health protections that are based on relevant public health data, rather than defer to these very loud and passionate, but incredibly misinformed expressions of opinion about public health matters. I have submitted written public comments where I express concerns that the current draft of a communicable disease ordinance must be revised in order to be effective. It is not broad enough. It does not give our public health officer enough authority and discretion to do what needs to be done to get St. Croix County back into the green risk zone. I would ask that you substitute version 3 and recommend its adoption. That allows people who know what they're talking about to effectively, reasonably, necessarily do what needs to be done for the public health and the public good of all of us in St. Croix County. Thank you.
Thank you, Celeste. Megan Rosowski.
Yep. Hi, can you hear me?
We can. Go ahead, Megan.
Hi, my name's Megan Rosowski. I live in St. Joe's with my 2 young daughters and my husband. And I want to thank the committee for working on this ordinance. And I know it's very difficult in the face of opposition. I think it is Veterans Day, and it's important to think about what our veterans have sacrificed. And it's huge. And what we're being asked to sacrifice, many of us adults, is to not go to restaurants, not go to bars, and stay home so students like the one we heard speak earlier can go to school and see their friends as we stop the spread of this disease. We need to focus on the health of our community, which is what will bring about the health of our economy. It's a false dichotomy. If we keep the bars and restaurants open with no limits, the disease will spread. People aren't going out to eat who are worried. We will have more and more of our citizens die, possibly become permanently disabled. We need to stop the spread of the disease, wear masks, impose limits on the number of people in places until we have a vaccine. And that's how we're going to restore the health of our community and our economy. So please pass the ordinance. Please help keep my baby safe. And I'd love to be able to send my kid to school safely, and for kids like Nick to be able to go to school and see his friends more after we take care of this. Thank you.
All right, thank you, Megan. All right, we have Paul up next.
Anyone else online, Ken?
Yeah, we have more online. So Paul is up next.
Okay.
I see you've unmuted, Paul, but I can't hear you. All right, I'm sorry, but we're going to move on to the next one. All right, so I have XT 1585.
I have no idea what my username is. I just assume it's my first name. I come from the evidence room.
Hello, can you hear me?
Yes, go ahead.
All right.
I am opposed to this ordinance. This ordinance is about controlling people, not the virus. It is against the First Amendment freedom of assembly. This ordinance controls how many people can be in my house. Why can't educated consulting adults make their own decisions and risk to sit at the same kitchen table? Also, this ordinance doesn't address those who have already had COVID and do not pose a risk to others. This is simply control over all people, not the virus. Thank you.
All right. We have Charlene Marie.
And so I'd actually give you my phone to the gal next to me because she wasn't able to connect. So here you go. Hello, my name is Suri Lieber. I live in Warren Township. I want to say that this proposal scares me, and I'm in full opposition of it. It's worse than COVID. We elect our county board supervisors to deal with issues like the pandemic. I do not agree with giving this authority to a public employee, a health official, who has a higher percentage of keeping their job along with a public pension and a nice health care package when they retire. And we elect officials that can have some skin in the game. And this is why, Greg Telejohn, I would like for you to throw this out, this ordinance. I feel this is also not a pandemic as we were originally told. We have had not 2 million deaths, and we only have what now the latest 16 deaths here in this county. We have, I guess that's just what I need to say. I want this withdrawn. I'm not in full in opposition for it. And thank you for your time.
Thank you very much. All right, Mark Carlson, you are up.
Hello, can you hear me?
We can hear you. Go ahead, Mark.
Hello, my name is Mark Carlson. I live in Stillwater. My wife and I are both veterans, and I can't believe we have to come here on Veterans Day to defend our rights. When we joined, we made an oath to defend the Constitution against enemies, foreign and domestic. This ordinance you're planning is so clearly against the Constitution. It's just clear to anybody simple, minded or not. I also can't believe the attitude that I see. I've been to several of these meetings. I can't believe the attitude I've seen in both the emails and in persons of people on this board. Mr. Cox, you forget that you're in the whole board. You're not just elected officials, you're elected workers. We're the ones that elect you. You work for us. And to try to stand on our rights just is not gonna fly. Mr. Cox, you said at one of the meetings, I'm tired of listening to non-lawyers. Well, us non-lawyers are your boss. You work for us. We don't work for you. Also, you never have the right to step on any of our constitutional rights. I don't care what is going on. And you said that you think that you do. You're wrong, sir. We're going to remember, we're organizing as a group. We're going to remember who voted for this, who's for it. And we're going to make it so that none of you will even be able to be elected dog catcher in this county. We will organize against what you're trying to do. Thank you very much.
All right, thank you, Mark. All right, we have Addison up next.
Hello, can you hear me?
Yes, we can. Go ahead.
Okay, I'm sorry. I'm Addison Geriatra. I live in Hudson, Thanks for rewriting the ordinance. I was around 800 people on election day that I didn't know 95% of people wore masks. I didn't get COVID. It's such a simple request that some people and adults choose not to follow. Please help the economy, schools, and the healthcare workers to get this under control. As people have spoken about their concerns in regards to that as well, I hope that to help with the 25%, there is something that can be given to businesses to keep them afloat. But since it expires at the end of the year, hopefully we can just get it under control and move on with our lives. That's all I have to say.
All right, thank you, Addison. We have Roy Schoberg up next.
Hello, everybody. It's Roy, former county supervisor. And my goodness, such emotions. Emotions brought upon all of us by a disease called COVID. We're not all on our best behavior. And I'm hearing the very sincere concerns of the patriots. My dad has a Distinguished Flying Cross from the Korean War. I consider myself to be a patriot too. No one owns the American flag. That's all of ours. We're all Americans. But I'm really concerned that now Minnesota has just closed down its bars after 10 o'clock. We experienced a few months ago what it means when Minnesota can't go out drinking after 10 o'clock. Where did they go? They storm Hudson. This is going to be a super spreader. It's going to just be an awful circumstance. And the city of Hudson can't really act. They're looking to the county and the public officials to do something about this. So while you've listened and listened and listened to the very loud concerns, there's at least 85% of us that know that wearing a mask is smart, that not congregating at bars is smart. But still, there are those that go ahead and do it. So without some type of an ordinance, what are we supposed to do? Just let it happen? No, I think it's time to stand up. Let's be brave. Let's take responsibility. And I just pray that the personal attacks against you don't continue. I know what it's like. I received them too from the same group. So carry on, folks, and do the right thing. Thanks.
All right, thank you, Mr. Schoberg. Kelsey Janetsky, you were up next.
Thank you. Can you hear me?
Yes, we can. Go ahead.
All right, thank you. So the individuals who are speaking say that they're speaking for others, but I want to remind the board that they do not speak for all residents of St. Croix County. The reality is that this group doesn't care about protecting others in the community, and you don't have to look further than the government center with their sniffles, coughs, to know that they're not going to stay home even if they had symptoms. It's clear that their understanding of the law, science, and data is infantile at best. So where does that leave the rest of us then? At home, like me, hoping to ride this out and make it through Christmas with my grandparents still around. The 16-year-old that spoke, guess what? The group that you're surrounded by is the one that's choosing to prolong the plexiglass in your schools and the so-called mask muzzle that you have to wear every day. So board, my ask to you is that as you deliberate, you remember that they don't speak for everyone and on or behalf of anyone other than themselves. And they certainly don't speak on behalf of me. Thank you for your time and effort on this. And even if it ends up wasted as the result of bullies, ignorance, and groupthink.
All right, thank you, Kelsey. Carrie Reese, you are up next.
Hello, good evening, and thank you for listening to us. Yeah, emotions are running really high, and I think we all are dealing with some combination of COVID fatigue and just frustration at having to deal with the realities of it. My ask of you is that you do deal with the reality. Just write that word down, reality. In a crisis, we often have to make decisions with incomplete information. And it's only with 20/20 hindsight that we can say, yeah, that one was right on the mark or that one was way off. But we do know some things. And those things that we do know require that they be bumped to the front and that they be the priority. It's really the test of leadership. One of the books that I recently read was about Winston Churchill, The Splendid and the Vile, which I'd recommend to any of you. And while in retrospect, we all know the arc of that story and how he helped save Great Britain, a lot of what he did was tell people what they didn't want to hear. They didn't want to hear. But he dealt with the reality that he had in front of him, and he framed everything for people, the people of his country, to say, if we don't act, here's what the consequence is. And that's what I encourage you to do. I think a lot of people right now, this is distant, we're afraid of what the consequences are, but they don't have a clear picture of, if we do nothing, what does it look like in this county? When I hear someone come on and start to parse numbers, I am reminded of, and you can Google this one, the Ford Pinto case. And it's an old legal case, but there was a company called Ford Motor that lost a lot of market share, in part because they did a cost-benefit analysis about the number of deaths that their company could absorb over the cost of replacing a little $11 bolt in their emission system. So, let's not let what is good for all of us get in the way. I know that you're listening. No one can say you cannot listen, but a lot of people have treated you with abuse.
2 minutes.
So, thank you.
Thank you, Carrie.
Okay, we're going to do just a couple more.
Yes, sir. All right, Reed, you are up next.
Hi, my name is Reed Filiacho. I am a resident of Hudson, and I'm in favor of an ordinance. All the drama, valid and otherwise, surrounding this ordinance does not change the numbers. COVID is still real. The election is over, and it didn't go away. The number of cases is escalating. How many hours of fear-mongering and alternative facts do you need to listen to? Almost 250,000 dead in this country, and we're still debating science and whether this is a big deal. This would be comical if it weren't so embarrassing and horrifying. I'll keep saying it. This is not going away until you do something. At the end of the day, the leaders in our community, those who have the ability and power to do something about this, are going to be responsible for what happens. And the writing is on the wall. You know what's going to happen. I'm also scared about losing my job. I've already been laid off once during the pandemic, and an unchecked virus is going to lead to another lockdown and hurt businesses worse than an ordinance. Ignoring this and listening to people who don't believe in science or understand tyranny or care about the health and safety of their community is doing an economic disservice to this county. Please do your jobs, pass the ordinance. Thank you.
All right, thank you, Reed. Michael Sikora.
Hey, can you hear me?
Yes, we can. Go ahead.
Thank you for your time. My name is Michael Sikora. I live in Somerset Township. I want to start by saying I oppose this ordinance. I emphasize personal responsibility, and everyone needs to take their own responsibility and accountability for your own health and own risk. To me, these kinds of ordinances are about individual decisions. Everyone should be able to choose for themselves whether they want to go out of their house, seek employment, or not. And you're welcome to stay home if you feel like your risk tolerance isn't high enough. I also want to emphasize professional accountability for results. Our health ordinance people across this country, not just across this county, don't seem to have accountability for results. Despite the best efforts of mask mandates and otherwise, the numbers continue to go up, and nothing a local health ordinance person could do would change that. Not even on the state level. Perhaps on a national level with a complete and utter lockdown like they did in China. However, I'm not in favor of that either. So what accountability do our government folks have to delivering results? The results aren't showing for that. So why would we continue to employ these kinds of methods for no results? And a couple folks spoke, Sarah Yakub and others, about listening to lawyers and doctors, implying that she being a lawyer and the lawyer to follow her were the only people that were smart enough to be civically responsible. And I absolutely disagree with that. Every one of us has a civic responsibility and has a baseline understanding of our rights. Basically, I want to finish up with a couple more things. The Ford example that the lady just prior to me had addressed, deaths to a piece of hardware, is an unbalanced situation. Our government folks, non-elected, don't have to worry about the balanced approach of maintaining an economy while improving our health. And so without the requirement of maintaining the economy, there is no counterbalance to their objectives. Their objective is unilateral and singularly focused.
That's
To
2
finish
minutes.
up, I do have one question. My question is, does the county still have the refrigerator truck that was brought on site to stack the bodies that was anticipated at the beginning of this pandemic? Thank you.
Thank you, Jason. Or Michael, sorry about that. Thank you, Michael. All right, Charlie Hawkinson.
Can you hear me?
We can. I'm getting a little bit of feedback.
Can you hear me okay?
Yep, I can hear you good now. Go ahead.
Okay, I need to do a little follow-up comment. The last time I spoke with you about the great white throne judgment when we'll all stand before the Lord God Almighty and give an account. And the good news I have for you today is that there is a way to escape that, and that's through the Lord Jesus Christ. He said, I'm the way, the truth, and the life. No one comes to the Father but by me. And so by trusting in him alone, we can avoid that. And that has to be central to everything. And as for your ordinance, I'm opposed to it. And one of the things I want to remind you of is that whatever ordinance you make, you yourselves will have to live by it. For example, part of the ordinance would be how would you feel if I came into your home and removed a loved one for not a really good reason to an undisclosed place that you didn't know about, where I could indoctrinate them and do whatever I want with them? Would that be okay with you? This ordinance will affect you, your grandchildren, your own lives as well. This isn't just something that you're going to make for other people. Right now you're in control, but that will not always be the case. And someday you yourselves may be subject to the ordinance that you make. People escaped from communist Soviet Union because they hated it and they wanted to escape. The ordinance you make could come back and affect you as well. And so I challenge you to seriously consider what you are about to do here. Thank you very much for considering my thoughts.
All right, thank you, Charlie. Chair Osnes, are you done, or you want one more? Or
Ken, how many more have you got on your list?
I have 22 more on the list.
How many?
22. We've gotten through.
We'll go until 6:30 and then I will cut it off. That's giving everybody an extra 20 minutes.
Yeah, Charlie was 30. All right. So Kay Emerson. And what time did you say, Chair Osnes, you wanted to go to?
Can you hear me?
Yes, we can. Go ahead.
Okay. I just want to thank all of you for doing the work that you're doing. I'm really embarrassed by the people in our community that have been threatening you and not understanding science. I really, I hope you keep going with this, and I support an ordinance sooner rather than later. And I guess that's all I have to say right now. I'll give time to other people.
All right, thank you. right, Catherine Klein was up next, but I'm afraid I have an error message on yours, Catherine Klein. You have an older version of Zoom. You're going to need to update that. I'm going to have to go on to the next person. The next person is Shelley.
Hi, can you hear me?
Yep, but I'm getting feedback. You need to be further away from the microphone or speakers.
Hi, my name is Shelley Vance. I'm a Hudson resident. Thank you for letting us all speak. We really appreciate it. I just want to say Pierce County passed this ordinance about 4 months ago. And has this worked? Did it help contain the virus? Has it brought us to the green zone that we want to be at? Last time I was in the River Falls area, I saw everyone wearing a mask. If masks worked and the ordinance worked, did it stop the spread? Did it do its purpose? Why are cases going up in Pierce County? I oppose this draconian ordinance, and I please ask that you withdraw it. The role of the government should be to give advice and not mandate health advice. Thank you. That's all.
All righty. Thank you, Shelley. I have a Zoom user up next.
Hello?
Yep, if you could please state your name, please.
My name is Chloe. I'm a Hudson resident.
If you could also move further away from the the speakers.
Okay, is that better?
Yes, it is. Thank you.
All right, so I'd like to first start off by saying Sarah Yacoub was obviously a plant. Every one of you smiled when she came on. Other than that, I'd like to point out that every single person that's been in favor has referred to bullies that are telling you that this ordinance shouldn't be happening, and how people that disagree with it are bullying. When, as someone that has a medical condition and cannot wear a mask, I'm bullied and ridiculed, yelled at in public every single day and questioned about my medical conditions. If you pass something like this and people feel like they can enforce that on me and they're going to call the police on me or call the health officer and try to have me fined, that's just going to make my life so much more difficult. This is completely about control. People are coming on here and stating laws that prevent this from happening, and yet other people are coming on and saying that that's bullying. And so I'm completely against this. And I am someone that does not have an infantile understanding, as one woman mentioned, as someone with a biomedical degree working towards a doctorate. And so I'm completely against this, and it's a way of control. Thank you.
All right. Thank you, Chloe. Tiffany Schmidt, you're up next.
Can you hear me okay?
We can. Go ahead.
Great. Thank you guys for listening to all of us. The point I wanted to make is that I'm opposed to the ordinance, and the reason for that has nothing to do with COVID. COVID's become a very polarizing circumstance, pandemic we're all dealing with, and everyone has their feelings about whether it's legitimate or not. The concern I have with the ordinance is the overreach in language, that it doesn't pertain only to COVID. And it extends to such a way that a health officer at any point could pass by my household, hear someone coughing, and decide that it's their right to remove them from my home and take them somewhere else for that reason. That bothers me. It also bothers me that there are business owners who also have health concerns where they may not be able to wear a mask or have some reason why they're not wearing a mask. And this health officer or someone else who's reporting to them goes into that business, says this business isn't abiding by it, and then shuts them down and fines them $500 a day for however long they see fit for remaining open. As a small business owner myself, just from what's happening with COVID and the election, without any of these ordinances in place, we're all struggling already with not having customers, not being able to provide for our families. We're overstocked for the holidays and hoping that we'll be able to sell out that inventory. And I'm just concerned that with this ordinance, it's only going to make all of those things in our local economy even more difficult to deal with. Thank you for your time.
All right, thank you, Tiffany. Samuel Cast, you are up next.
Hello, everyone. Can you hear me?
Yes, we can. Go ahead.
Thank you. Good evening, Chairman Osnes, board members, and other members of the public. Thank you for the opportunity to speak. My name is Sam Cast. I'm a resident of Hudson, Wisconsin on Vine Street, and I believe there are three things that I should really state. First and foremost, I am a recent graduate of Gustavus Adolphus College, and I've lost my senior year due to this deadly pandemic, and I am one of the lucky ones. Many others have lost their lives or have now lifelong disabilities due to contracting this deadly disease. I hope that each of you find it in yourselves to empower yourselves, those around you, to pass this ordinance so that we can protect more folks and overcome this deadly pandemic. Furthermore, I must say to the other members of the public that have scarily said about how we trample on liberty, to strongly suggest reading Jacobson v. Massachusetts, 1905, under the Supreme Court. This is what has empowered us as members of the government and public health practitioners to conduct their business to protect members of the public. Lastly, many individuals have brought up a statement from the Wisconsin Manufacturers Commerce, or the WMC. They have long battled against public health priorities such as removing lead paint, lead piping, and my apologies, lost my train of thought. These public health priorities that establish healthy relationships within the family, as well as make sure that children do not have lead poisoning. So please pass this ordinance. Please protect us all. Thank you.
All right, thank you, Samuel. All right, we have a phone-in caller now. Go ahead. Can you please state your name?
Sure. Hello, my name is Rachel Everson. I'm a Hudson resident. And I agree with many of the statements that have been made that COVID-19, unfortunately, is polarizing. I think the topic of masks is polarizing. But really what many people are concerned with is that the health officer does not have to have a medical degree to be in that position. That's concerning. Two, that some of the policy that's being written is vague and nonspecific on purpose so that it covers a wide range of information, which is alarming to people if you were to extrapolate it out 5 years. I understand that we are trying to control a pandemic and that we are trying to make positive legislation to try to control that. But what I would say to you is that as policymakers, you have to step away from the fear and really look thoughtfully at the language that you're using, that it's clear, it's specific, it's time specific, and that it's not an overreach of power, like being able to go into someone's home, remove an individual. These are the things that would make it alarming to individuals that are reading it. And that is why people are speaking to liberty and freedoms. I don't think anyone questions the need to be thoughtful, conscientious, and wash their hands. I certainly am asking in public to be thoughtful of those things. But it's when it crosses the line into personal autonomy, medical freedom, informed consent that I think we have to stop and ask ourselves what's driving this policy and how do we do it thoughtfully, and how do we do it so that it doesn't drive future policy that goes even further in 5 years. So that is what I have to say about this. Is that, yes, we can be thoughtful. Yes, we can be thoughtful about how we're moving forward. But I would say that this ordinance is an overreach of some of the things that we're hoping to gain that are positive and do come with some concerns that we have to be thoughtful about, especially in the face of fear. Fear drives a lot of policy, and we have to be thoughtful and clear and specific about what we're writing into law. Thank you.
All right, thank you. And we have Paula Oliviers. Go ahead, Paula.
Hello, can you hear me?
Yes, we can.
Okay, thank you. My name is Paula. I am from Woodville, and my comments on this ordinance are not to do with the issue of COVID-19, but with the agenda behind it. So whether you are aware of the agenda behind it or not, please let me share this with you. Socialism has always failed. The French tried socialism and got Napoleon. German philosopher Hegel said, "The state is God on earth. This lays the ground for Hitler." And guess who attended the University of Berlin, where Hegel taught? Karl Marx. In times of crisis, people panic and give up their freedoms. So Hegel taught to create crisis and speed it along. His theory was the triangle theory. One side is a thesis, another corner is antithesis, top is synthesis. In other words, you start out with the status quo, you create a problem that is real bad, then everyone is happy with your answer, it's not half as bad as the crisis. Then you create another problem that is real bad. You keep doing this because after each crisis, people surrender a little more of their freedom. Before you know it, you cross the page from the people ruling themselves to a dictator, tyrant, governor, etc. Karl Marx said, "How do you create a crisis?" His idea was to send in agitators, provoking agents, community organizers. Their job is to identify people groups and divide them. Rich against the poor, black against the whites. It doesn't matter who, but the goal is to make one the victim and the other oppressor and stir the pot until they fight. And people give up their freedoms to some governor or mayor who promises to restore order. 45 countries fell to communism this way. The United States Supreme Court 1884, in reference to the individual's God-given rights, stated, "These inherent rights have never been more happily expressed than in the Declaration of Independence. We hold these truths to be self-evident, that it is so plain that their truth is recognized upon their mere statement, that all men are endowed, not by edicts of emperors or decrees of parliament or acts of Congress, but by their Creator, with certain inalienable rights, and that among these are life, liberty, and the pursuit of happiness, and to secure these, not grant them, but secure them, governments are instituted among men."
Thank you, Paula. I'm going to cut you off there, trying to keep it to the 2-minute limit. Up next is Anton Ray.
Hi, can you hear me all right?
You can, go ahead.
Thank you. My name is Anton Ring. I'm in Holton, and I just want to state that I'm strongly in favor of an ordinance to start reducing the amount of community spread of the virus, COVID-19 disease causing coronavirus, in our community. Wisconsin has unfortunately been behind the curve on this. Partly we've been hamstrung a bit by court decisions and by the legislature's refusal to deal with it at the state level. If people have been paying attention, the case counts are up around 100 a day, nearly 100 a day now. If we maintain a similar death rate, that means about one person per day is getting infected who's likely to die of this disease. Personally, I have stopped going to businesses in St. Croix County entirely because I don't know when I go in if people are going to be taking even basic precautions like washing hands, let alone wearing a mask. From a business point of view, I think that getting this virus under control is the best thing for our local businesses. I think the version of the ordinance that we had last time was probably better than the one that's on offer now, which has much less mandate. But I strongly encourage the board to do something that will help start bringing our case numbers down. Thank you.
Do one more, Ken.
All righty. Colin, you were the last speaker of the evening, it looks like. Go ahead.
Hi. Can you hear me all right?
We can.
So I'd like to bring up the points that Saria Koob stated are the same points that she ran on in this recent election and lost. So if you put this ordinance to a vote, the people will show you that they do not support this, as they did with the recent election of Saria Koob. Another point is that if you would like to prove that this is not just a power grab, put it to a vote. The people will strike it down. This is a clear overreach of power, and last I remember, the Nazis lost the war. Have a good night.
All righty. All right, Chairman Osnes, I turn it back over to you.
Great, and thank you for everyone who's made public comment. We'll move on into our business items and get a COVID update from Public Health. Ellie, are you there?
I'm here, thank you.
Is there as well?
So I don't know if we have the presentation. Can we see that?
Yep, I have that. Give me a second to share that.
While he's pulling that up, I just want to thank everyone for coming out, telling us, their thoughts on this matter, and really honestly to say thank you for everyone who has served and continues to serve with this being Veterans Day. I've expressed before, I have veterans in my life, and it truly is one of the greatest things that we have. So very appreciative of all the veterans. Okay, here we go. I am going to turn this over to Ellie to talk about data and statistics, and then I will follow up with a little bit of how we have changed our response in light of increased cases here in St. Croix County. Go ahead, Ellie.
Thank you, Kelly. All right, thank you for having me tonight again. What you see in front of you here is a summary of our St. Croix County dashboard. This is what's posted on the St. Croix County's website. The dates here are the dates of all of our meetings here at the Health and Human Services Board meetings where I've presented. Now, what you can see is a trajectory since September the 16th up to, as of yesterday, where we had a complete confirmed case count. We had 97 cases reported to the county yesterday, which brings our 7-day average, look back, 7-day average of confirmed cases to 87. So that's an average of 87 cases coming into the county daily, being reported to public health. And then our total, can you hear me?
No, Ellie, I'm going to stop you only because you're kind of echoey. It's really hard to hear you.
Is this any better?
Maybe. Can you go ahead and continue?
Okay. Interrupting again if it becomes too hard to hear. And so our total confirmed cases as of yesterday was hovering just under 3,000. We have since crossed that today, which is reflected in our dashboard, which is updated in the afternoons every day as to that point in time. Our total deaths, as been talked about previously, is up to 16. Okay. And what that looks like is that's actually a 60% increase in deaths since I last presented data to the board. Our currently hospitalized is totaled at 31, divided between currently hospitalized in St. Croix County and currently hospitalized outside of St. Croix County. That's also a 60% increase in hospitalization since I last presented data to the board. Next slide, please. So, as we know, and as we've talked about, the trend in the number of new cases reported to public health is dramatically increasing. We see this climb here with kind of the slope of the line going straight upward. We actually have now crossed over 100 cases being reported into public health, now 3 times, including today. So, as we move to the next slide, we can see that this was a past trend in what I presented last time. Now we were at 30.4 in our average number of new cases per day. And so if we see today, go to the next slide. Right, we're at 88.8. So as you can see, it's all just going up. So if we go to the next slide, we again look at our past measure of trending confirmed cases by case incidence. Now this is the measure that we use to be able to compare ourselves to other regions, states, and likewise. We were previously at 33.5, and if we go to the next slide, you'll see that we have changed the slope of that line dramatically, and we are up to 98.6 as a daily new case incidence. So then I have included two metrics that have been used to kind of give us a perspective on this. Obviously, we've already talked about the Harvard Global Health Institute, which has brought us obviously into the red zone with greater than 25 new daily cases per 100,000. In the second box there is actually the new data that is available for everyone on the DHS website. They have actually created a level beyond very high that is included critical due to the incredible increase in cases. And so Wisconsin as a state is at critically high, and St. Croix County is also at critically high case activity. That case activity is based off of burden, which is the case rate, and also trajectory, so where the number of cases changes. So we're obviously in an upward trajectory. More information on how that data is collected and delivered is also available on the DHS website. All right, next slide, please. Okay. So we have all heard about one way to find more disease and control the disease is to have access to testing. So we have started the Wisconsin National Guard free COVID-19 testing here in Hammond and Somerset. So just to give the board and the community an update on how that has been going, we see here we have tested a total of 940 people. We have actually at Hammond, that was the maximum number of tests, and they increased it from 300 in Somerset on the 29th to 450 because we did have such a demand for testing. We did find in total about a 21% positivity rate of those tested at the Wisconsin National Guard. Positivity rate is something that as an epidemiologist I look at in determining how much disease is in our community, how much are we finding, are we testing enough to do it? And with such a high number, I think we're not doing enough testing because we're obviously missing some disease with such a high percent positivity. Okay, next slide. So where are these positive cases within our county? So this is active confirmed cases by St. Croix County. So this is someone who's been diagnosed within the past 30 days. We have seen them about 36% in Hudson and about 21% in Richmond. 0% does not mean no cases here. 0% does mean that the percentage is so low that it's a 0 point percentage. Now, in past, Hudson has usually had about 50% of active cases, but now as we have such a growth within St. Croix County as a whole, other cities and towns and townships are taking on more cases. They're finding more cases within their community. So we do see that Somerset is at 8%, Baldwin is at 6%, as well as River Falls. Next slide, please. Thank you. All right, so now looking at these cases, as we started in April to October, what I am hoping you are all able to see, and you may not be able to see due to the bottom line on this graph, is that each of these bars that you see, these colored bars, represent an age group. So going from left to right, you will see that we have 0 to 9, and then we have 10 to 19, so on and so forth. So what is the trend telling us? The trend, obviously, we're seeing an upward trend in cases across all groups, but our largest upward in increases in that gray to green area. Now, those are our adult population. So those are our 20 to 59-year-olds that are kind of increasing more dramatically than the other groups, our number of cases within the community. All right, next slide, please. So this is another one of those trend pieces. So the percentage of COVID cases by age group. So of our active confirmed cases, again, those diagnosed in the past 30 days, and not this, I would like to make a point clear, this active number is you have spoken to public health and we have released you from isolation. You are no longer considered active. You have recovered your disease. Thank you. So active, what we see is an overall trend here. We see again that 20 to 59-year-olds that are driving this trend. So the spread, the positivity is by highest proportion in our mobile, not student, not older age groups, but in the general adult population is where the majority of these cases are. Next slide, please. And so where are these cases coming from? So this is reported exposure. So this is during an interview where a public health employee will call the positive case and ask them where they report or having had exposure. So the highest percentage has said community acquired, which may be at a bar, at a restaurant, at a funeral, in such area. The next is household contact, followed closely. So this is where one member of the household becomes positive, and then that spreads within the household, and other household members become positive. The third one is close contact. So this is that they have a friend who notified them, I was positive, we spent time together last week, and so they know that they have had that close contact with a positive confirmed COVID case. Of those three measures, as an epidemiologist, I look at those high rates within the adult portion, the adult age groups, those 20 to 60-year-olds, and I look at community-acquired household contact and close contact, and the trend being that the movement of these individuals in this age is bringing positive cases into the household. We're not seeing it as much in the schools from the data that transmission is going on within the school itself. Instead, our positive cases in the school, the majority occur because there is already a positive parent within the household or another positive household member in the household. So it speaks to where our individuals are exposed and where we're holding the highest number of cases in that community. Next slide, please. So here's a summary of the deaths in St. Croix County. This is the data on 16 deaths, so I was able to summarize it for the meeting this evening. But as you will note on the St. Croix County dashboard, we do now are reporting a 17th death. So we currently have 17 deaths. The data you see before you is representative of the 16. We have 3 females and 13 males. 1 for 50-59, 1 60-69, 7 in our 70 to 79-year-old age range, 1 in the 80 to 89-year-old range, and 6 for 90 or above. Okay, let's move on to the next slide. Here is hospitalization information for the Northwest group. The Northwest group is one of 7 groups within the state of Wisconsin that has formed to understand hospital capabilities. This information can also be found on the DHS website. So what we're looking at here is that COVID patients in this Northwest group, and you can see here by the map what counties are considered in the Northwest group. The COVID patients hospitalized have greatly increased. This is actually, you can't see the dates, but this is only from the middle of October. So if you do want to reference the actual dates, on the DHS website. They're there for you to pursue. The number of patients hospitalized is rising. The trajectory is upward. We currently have 80.5% of our hospital beds are in use, and 92.5% of our ICU beds are in use. Okay, next slide. All right, so that does conclude my portion of the data coming from St. Croix County, and I will pass it on to Kelly for her next slide. Thank you.
Ken, I'm not sure how you want to do this. Do you want to allow for questions of Ellie, or how, or maybe I should be asking Chair Osnes? I'm sorry if I messed up.
Oh, that's okay, Kelly, and we appreciate your presentation, you and Ellie both. Are there any questions from the board?
I do have a couple more slides that I want to talk about how we've had to change our response a little bit for public health with the increase in numbers. Okay, so I'll just go on with that. It's not a ton of slides. I threw together this really elementary looking graph, but I kind of wanted to create a visual for people of identified critical response partners in this. First and foremost, I think for St. Croix County, our staff are absolutely involved in this. I think it's important to note we typically, before pre-pandemic, we have 16.57 staff allocated to DHS. We have been gratefully helped out by decisions that supervisors and boards have made to say, yes, get public health the help. We have increased our staff by 22 bodies. That does not mean 22 full-time employees. 5 of those 22 are no longer with us, and we lost 2 really good soldiers who were helping us fight this because they were over their hours and could not continue to work. And they were 2 people that were retired from St. Croix County Public Health that came on board with us to provide leadership and guidance and help us in this response. So one is a very own board member, Deb Lindeman, and the other is Sharon Razor, who was a longtime public health nurse supervisor. We thank them immensely. We're working a lot with different county staff, our HR departments, our administration suite, corp counsel, as well as many department heads. Formed a new partnership with our Highway Commissioner, Robbie Croix, who has given me ideas to think about related to the impending winter we're going to face. And what do we do when we have highway workers on quarantines, and can we allow them to safely work? I just want to try to paint a picture of all the different things that are coming across public health's plate. There is a ton of partners involved in this, definitely our state DHS partners, as well as critical partners within our communities, key stakeholders as well. They're kind of, I didn't want to lump them together because I truly believe our local hospitals, our local schools, our local long-term care facilities, and probably many other that I'm not naming that we are having either daily or at least weekly conversations with to try to respond to all the challenges that they're faced with in trying to navigate with the increase in cases. And then, of course, the public. The public is absolutely just a part of this response as much as anybody else. And Mr. Telejohn, did you have a question, or are you? I thought, okay, good. I didn't want to interrupt. Okay, next slide. Okay, so public health roles. Remember, I've talked about this a little bit about what is public health's lane in all of this. And really, public health's lane is coordination of testing. the actual disease notification and contact tracing. And now we're getting into this new realm of, okay, there's some good news that a vaccine is available. Well, if you don't know, public health is an entity per the government that does help coordinate vaccine administration. So we're going to be moving into this also humongous undertaking of helping distribution, procurement, distribution, and then administration of the COVID vaccine. This is just starting. We are just getting word that we will be getting doses in the state of Wisconsin. And we've gotten to really increase our communications with our local hospitals. We were only meeting once a week with them, and it was with the CEOs and presidents of our hospitals for all of Pierce, St. Croix, and Polk County. And they asked us last 2 weeks ago for a more regular check-in. So we have increased those meetings with their chief nursing officers and other higher management and supervisors for twice a week check-ins to discuss patient loads and bed capacity, so they can work together on lateral transfers and transfers within the region versus having to look towards the cities, which is the normal pattern of where patients go, or Eau Claire, or sometimes even Duluth. I know we have had a patient hospitalized in La Crosse. Bed capacity is absolutely an issue, and we're hearing it now twice weekly on this call that we are having with hospitals. I want to talk a little bit, next slide, please. I want to talk a little bit about our crisis standards of care that we have had to implement because we have had 900 cases in the last month. I'm a believer in creating efficiencies. It's really hard to create efficiencies in a pandemic because it seems like something new is coming at you every day, and it's hard to take a pause and step back and think about how can we do things more efficiently and more effectively and still get notification to positive diseases. We've worked with several people, not just our health department, but we listen to what is allowed, I guess you would say, from the DHS. So when I say DHS, I mean the State Department of Health Services in Wisconsin, to say, what is allowable? What are the absolute things we need to be doing with this increased capacity and high number of cases, because we just don't have the staff to keep up. One of the things that we have done is really look at prioritization of cases. When we're getting 70 to 100 plus cases a day in, we have had to take a real close look at how we can, I don't want to compare it to getting, what's our highest return on investment and who should we really be focused on? So we are prioritizing cases that are age 60 and older. We know they have the worst outcomes from COVID, as evidenced by the death slide that Ellie discussed, and also our 19 and under population. Although we aren't seeing a ton of spread within the schools, we know kiddos have lots higher rates of being asymptomatic and still testing positive, which does create the perfect storm for them to become spreaders and increase transmission of COVID. Some of the things that we've had to do over the last I'm losing track of time. I should have written this date down. I do have it somewhere. We had to stop notifying after we do the disease investigation. I'll run through this very quickly, how this works. Once we get a positive case, we do what we call a disease investigation. That means one of our St. Croix County Public Health staff calls the disease, the person who's tested positive for COVID, and does a disease investigation. And Previously, before we implemented these crisis standards of care, part of that disease investigation included having that positive case identify their close contacts 48 hours prior to becoming symptomatic. And if they aren't symptomatic, then it's 48 hours prior to the date they tested. We've had to eliminate that piece from our response. So close contacts of positive cases are no longer getting phone calls from public health. Schools, just this week, unfortunately, the schools have been great partners and trying to do the best they can, and they deserve a huge kudos and feather in their cap for the work they are doing. We aren't, like I said, we aren't seeing a ton of spread. Ellie alluded to that as well. I heard the 16-year-old. I don't know what I would do if I was 16, 17, 18 during this time. I really mean it, that my heart goes out to our young people who are living in just a strange time right now. I do believe this will pass, and we just have to get through this time. Related to schools, we were helping the schools once they had a positive case identified, contacting all those cases that were associated with that. We were sending letters. That no longer is going to be happening effective tomorrow. We have turned that back to school health professionals and health aides and their office staff. If you know anything about how school districts work, they are very lucky if they have an RN on staff, and they are even more lucky if that RN is actually a full-time employee. The RN in a school district has great responsibility minus a pandemic, with individualized health plans and making sure the health and safety for each kiddo in that district is the best it can be. So we are sad, I guess. I am sad personally to say we just can't keep doing this with our schools. Hopefully we can get to a point where our cases aren't so overwhelming that we can partner back in with schools. Please hear me when I say communication with our schools is not stopping. We still have disease investigators at St. Croix County Public Health who have been identified as school liaisons. We have 6 of them for each of our 6 districts. So the communication will not stop. It's just going to look a little different. We are planning for some changes related to how we are going to contact. So Ellie kind of showed you those bar graphs. They were the green to the gray. So the ages 20 to 59-year-olds. We are working, planning for how to communicate positive cases to them, their positive status, or getting information to them related to their positive status via website and social media. And I think we have a good team that will likely get changes implemented within the next week on how notification to them is going to occur. I think it should be known that today we started Wednesday, and we have a team that assigns out all these positive cases, and that team just got to those 20 to 59-year-olds from Sunday today. That is how much we are behind with the prioritization that we have implemented. So is there any more slides, or did I just kind of end it? Next slide. That's the last slide. Okay, now we can take questions.
Kelly, I had a question. You talked about lateral movement of hospital beds. What is the status of the Twin Cities right now, and are our patients being sent there, or are they being turned away at this point?
Great question, and I don't want to answer for sure, because what I will say is they have a, oh, my screen just changed. We are lucky enough to have one of our CEOs who is on a daily hospital call with Minnesota. Myself, AZ, and the health officer from Polk County, we are not on those calls. So they give an update at each of the beginning of the hospital bed conversations. I don't want to say, Kathy, which one way or another, if they are accepting. I know that was one of the purposes for us to start meeting, because they were having more and more trouble placing people in beds in the cities.
Any other questions for Kelly or Ellie? Okay, well, Kelly, you and Ellie and your great staff, you guys are fantastic, and I know that you guys are tired, but you do an outstanding job, and we're going to try to do our best to see if we can find some more help for you folks. Keep up your great work. It's greatly appreciated, and our thoughts and prayers are with each of you and your families as well as we move through this. Thank you very, very much. Okay, and with that, we're going to move into our item number 2.
Chair Osnes?
Yes, go ahead.
If I might make a comment.
Yes, sir.
Kind of recap and summarize some of the things I heard is that we've seen over 1,000 cases in the last 2 weeks and 1,600 in the last month. If you look at the graph, the steepness of the line and increase in cases clearly indicates that we're in logarithmic exponential pandemic spread. And what that means is you begin to look down the road, a lot more cases. 150 a day, 200 a day, don't know. I'm not a prognosticator, but that's a real concern, especially as we move into the deer hunting season, which is a Wisconsin state holiday, Thanksgiving and then into Christmas. And that becomes a real concern. Hospitalizations have doubled in the past month, and we know that that is across the entire area. It is in the Twin Cities, and that whole system is quite strained. We know that the younger people spread this disease, specifically adults, between that 20 and 60 age group, but there are elderly residents who bear the brunt of the hospitalization, and unfortunately the deaths as well. So this is a virus that spreads with asymptomatic spread. So sometimes you have it and don't know it. You give it to people, you give it to the aide in the nursing home, you give it to someplace else. Or you give it to your friends or your family, as we've seen here. And the fact that it's spread among the younger people, but is damaging and harming our elderly people, isn't very fair, but the virus doesn't care. It exists only to reproduce and looks for every opportunity to do so. So the in-home party or the gathering at the bar or those kinds of things, it's best place to go to work. And to emphasize what Kelly has said, the number of things that have been taken off the table, the number of activities that they're not completing that would be ideal to complete, they basically skinning things down to bare bones. And they're still 72 hours out on disease notification. The standard is 24. And so we are 3 times beyond the standard for disease notification in our county. The problem with that is every day that goes by that somebody doesn't get notified. Now, hopefully they're being notified by their practitioner and provider. Most of ours in the county are pretty good about that. But every day that goes by that somebody isn't notified and isn't given that guidance is that day where they spread it to more people as they move out and about through the community. We know our hospitals are at capacity. We know that ICUs in the Twin Cities are full, if not close to full. We know that Mayo Clinic in Northwest Wisconsin has stopped elective procedures. We are aware of other concerns related to elective procedures in our Twin Cities and our local markets. Some schools have had to move to virtual learning because of a lack of staff, because again, as this spreads more widely in the community, it begins to affect the staff that are staffing our nursing homes, that are staffing our schools. And I'm aware of at least one school where they have had to close in-person education because they simply don't have enough teachers, because too many of them are out either sick or quarantined. And this is going to get worse. If we do anything today, we will see impact in 2 to 4 weeks. And that impact may be lost somewhat in Thanksgiving, but hopefully it'll blunt the effects of that. There's really solid evidence that masks work. There's no question in the medical community. There are a few outliers, but masks work. It's not a debate. It's clear that this spreads with indoor gatherings, especially if masks are removed and there are more people, and especially if there's alcohol involved. We know that. We know the vaccines are on the near horizon, but none have been released yet and will not likely happen before the end of the month. And even then, before it gets out in the general population, it's going to be months. It will start in certain small groups, but there's still only of the Pfizer vaccine, 50 million doses. for this country of 300 million people, and each person needs 2 doses, so there's only 25 million. So it's still going to be limited. So we can't lean on that to save our bacon at this point in time. It's still going to take everything that we do. What we have seen with Ellie's slides is related to places where they really are trying to follow the recommendations and the guidelines. Our long-term care facilities, our healthcare facilities, our nursing homes, those other organizations within our community that are really working hard on this and asking people to comply, asking people to come along with this, that's working. What is not working is our community. And our community at large is letting all of those other organizations down. And so that's the question on the table, is how do we get to someplace where we can help our community make those changes? Because without that, this will continue to worsen. And this is not the end of the road. This is merely a point in process, and the acceleration will continue. This is not how bad it is going to get. This is a stop on the road of how bad it's going to get. And we don't know how bad that's going to be. So thank you for letting me make my comments.
Chair Osmus?
Thank you, and I appreciate that. Paulette, go ahead.
Yeah, my concern is in the ticketing and enforcement. If you're going to start ticketing people that aren't wearing a mask. I mean, I had a lady call me and tell me she would, if this passed, she would call the sheriff every time she saw someone without a mask. And Dr. McGinnis said most of this transmission is happening in small gatherings in people's homes. So and I don't think that public health can be ticketing. They don't have the staff. The sheriff doesn't have the staff, and we don't need dispatch being called. I just think it's the wrong thing to be doing. So,
Chair Osmus, I'd like to put the motion on the table so we can have debate, if that's possible, please.
Okay, and that's fine. And before we get much farther, I guess I'm going to turn it over to Scott and your thoughts, sir, and help us out with this.
Okay, so you don't have to have something on the table to discuss it in a small board meeting or a committee. But I note that Supervisor Leaf has made the motion. There will be a need for a second at some point if you choose to go forward. So we've been through a number of revision drafts. I've personally drafted, I think I've got 6 different versions of communicable disease COVID ordinances. Some have just been drafts that have been internal that I haven't shared with anyone except my assistant corporation counsels and my paralegal. So the last draft of the ordinance, and some people referred to it this evening as being preferable, basically incorporated all of the statutory powers of the local health officer and made any order that the health officer gave, countywide or otherwise, enforceable by citation or other legal means. There was some language in that ordinance draft about going into people's homes under special warrant that was objectionable. There were provisions about quarantine that didn't necessarily have to be in that ordinance, but the general tone of the comments and feedback is, well, that ordinance is kind of vague and the statutory language is kind of vague. So what I did is basically make an ordinance specific to COVID. The ordinance would last a year. It would repeal in a year. It would provide a metric in which the public health officer could issue an order that had been essentially pre-approved by the county board, which is a form of oversight in that the county board has already reviewed this and would view this as an appropriate response if the health officer deemed it reasonable and necessary at the time. And if you want to go ahead with this version of the ordinance, do have one revision or amendment to clarify that point. So basically how this ordinance would work is that it wouldn't negate any other authority that the local health officer has, but gives her the specific authority to issue an enforceable order if a certain metric has been met, and that metric is the path to zero key metrics, in which the red level is reached, which means 25 cases per 100,000 in St. Croix County, which in real math terms, I think amounts to about 22.3, because I think there's about 91,000 residents in St. Croix County. So that would give her the green light to issue or consider issuing, if she thought it was reasonable and necessary, two types of orders: a mask ordinance or a mask order and a limiting of public gathering order. And both of those are mirrored or borrowed from the state's mask and public gathering orders that were issued by the state. So how this would work is if the COVID-19 red level indicates that 25 daily case level per 100,000, and that's a 7-day rolling average, that would trigger the right of the health officer to issue an enforceable order. And so that order would only be good for 14 days. That order could be renewed if that red level metric was read on the 14th day of the order, and so on. So it provides a mechanism. I mean, one of the things that we heard from the public, well, we don't know what reasonable and necessary, or we don't know when he or she is going to use this power. It provides some definition. So it basically, this is what the health officer can do under these conditions if she thinks it's reasonable and necessary. And rather than read through all of the ordinance, I guess I do have one revision, just to make it clear that under 4105, which is the section that I was reading, I would request that it be amended to contain a prefatory statement after the title that said, pursuant to WISDAT 25203, the local health officer has the duty to promptly take all measures necessary to prevent and suppress and control the spread of communicable diseases. When the local health officer determines that orders are necessary to prevent, suppress, and control the spread of COVID-19, the local health officer is authorized to issue enforceable orders regarding face coverings and limiting public gatherings under the following circumstances. So that would be the prefatory language, if that could be amended, if you want to go forward with this particular draft. Nothing requires you to adopt this draft. You can consider its policy impacts. I had one question from a board supervisor was, well, I may like the mask order better than the potential for reducing certain businesses to 25%. So would it be possible to just have the mask mandate within the ordinance? Certainly that's a possibility. Also is a possibility is to move back to version 3, which several people have voiced in both email and comments this evening that they find preferable, truer, and gives truer to the statute, gives the credence to the expertise of the local health officer. That's certainly also a possibility. But at this time, I'd answer any questions that you would have about this particular draft or any other alternatives that are available.
Any questions for Scott?
Can you speak to the enforcement that Paulette brought up, please?
Well, if there was no enforcement, it would just in effect be an advisory order. So it would lose the, it would lose the ability to issue the citation or to issue a warning, educate, and if they continue, then to issue a citation. Because in a lot of ordinance enforcement, the enforcement authority doesn't necessarily jump out and issue a citation first. They may give them a warning, an opportunity to correct themselves, and then issue the citation. So without the citation on the books, there's no enforcement or threat of enforcement for failure to follow an order.
Ken or Scott, don't you think that the sheriff's office would be just inundated with people calling when they saw someone? I mean, it would be.
They may be, and the sheriff's office thus far, I've had conversation with the sheriff. I don't think they're in a position at this point to enforce the ordinance.
Well, then it should be amended. I would like that part amended if it's not going to be enforced anyway.
It can be enforced by the local health officer.
But she doesn't have time at all.
Well, she's still on the call, Kelly, right?
Yep.
Yeah, I am. And you guys all know how I feel about writing tickets. I'm not one for punitive punishment anyway. I like restorative. I want to serve the best I can for St. Croix County and its residents. And I do want it to be known, though, that I am communicating quite frequently with Scott and Kathy, Under Sheriff Borg's deputy, Borg Schatz, related to this. So we haven't had conversations specifically about this, but I do just want to bring it to your attention that when Safer at Home came about, and there were many, many complaints about Safer at Home, we were able to route the complaint straight to public health. So I don't believe that inundated dispatch. So I think there are ways to work around that, but again, that's all. Sorry.
Kathy, go ahead.
Mr. Chairman, I move that we adopt the ordinance. And I'm going to read the number off an ordinance creating Chapter 14 of the St. Croix County Code of Ordinance entitled COVID-19 Communicable Disease Ordinance, with the language that Scott wanted amended, unless I need to do a main motion first and then amend it.
You don't if you've included it in the main motion.
Okay, so as you have amended it.
Anyone else with any comments?
It needs a second.
Is there a second? Is there a second to the motion?
I will second.
Okay. All in favor, say aye.
We need to debate it more.
Discussion. Discussion needs to happen.
You want more time to talk about it? Okay, go ahead.
I'll talk again, and I'm against the enforceable, the mask ticketing. It's just going to be crazy. So I would be against the ordinance as written if you wanted to amend it and take that out, but otherwise I'll be against it.
I'm not sure what else we could put in there if we didn't have some kind of enforcement. I don't know what's the purpose of doing the ordinance in some ways. I guess, I understand what you're saying. I can understand people thinking that we're going to get lots of calls and all that, but I'm not sure that's going to necessarily be the case. I mean, I think it's going to, we're sending a message. We are in we are in a crisis. Things are really, really bad. And I know that personally because I've been working for several months making these phone calls. And of those 16 people that have died, 4 of those were my cases. So that hits home to me. And I feel like, this is getting out of control. I don't think it's going to, it's not just going to go away. And I just think, this is you guys, we're the Board of Health. We're the health board for our county. We need to do something. And so if we don't do the ordinance, is there something else? I mean, we have to send some kind of message that this is serious and people have to take responsibility.
I agree with that. However, if we're going to do enforcement, a $100 citation is nothing. If we're going to do enforcement, then the amount would have to be greater than what the incident is. It's going to be repetitive. Getting hit with $500 every time you violated this ordinance, if it were to pass, is something that does give you pause to think. But at this point in time, for everyone who is against this ordinance, we're being proactive. This ordinance is proactive. We've come to a point in time where the incidences are rising so quickly. And I've spent the last 10 days doing nothing but working quarantine. So I'm well familiar with how the numbers are rising. We are going to have the state come in or the federal government come in and they will shut us down. Then we have truly lost our freedoms. This is the time to act. It is the time to take control of what's happening in this county and preserve the freedoms that we have. This ordinance may not be palatable to many people, but I don't like the idea of having to say goodbye to businesses. I don't like the idea of having bar owners call me and tell me that they're going to shut down, especially when it's establishments that have been in this county for generations. But again, this comes to personal responsibility. So for all of those who are not wearing masks, who are not socially distancing, I can't hold you accountable personally, but when a business closes and you happen to be one of the persons that likes to hang out there without a mask or socially distancing, then do stand up and take the credit for that business closing. At this point in time, we have tried it. We've been running roughshod in this county. No one wearing a mask, no one social distancing. It's all about freedom. Well, with freedom comes responsibility. And that responsibility at this point in time is standing up and being brave enough to not just support the veterans, but to go out and fight like they did. It's time to stand up and say, enough. We need to take the next 6 to 8 weeks and really come to terms with wear a mask, change it every day, wash your hands all the time, use sanitizer, support your local businesses, support your school districts. By doing this little bit of inconvenience, we may flatten the curve and not have to worry about the state coming down on our heads and saying, St. Croix County, Western Wisconsin, we're shutting you down because your numbers are too high. Whatever tweaks need to happen within this, what I'm going to suggest is that at this point in time, we have a new federal administration that will be coming in, and I have no doubt that there will be orders coming on a national basis. What I would like to amend, and I will propose an amendment to this, is within the effective date and sunset, that we work with this until January 31st of 2021. And if the numbers go down, then we will surely know that we have done the right thing. And if they don't go down, then we have to go back to the drawing board. But again, it all comes down to personal responsibility. And if individuals are out there and they're not taking personal responsibility and they are carefree with everyone else's health by not wearing a mask, by not social distancing, that is something we cannot control.
I would second your amendment, Supervisor Ard.
Okay. Scott, hold on just a second. Scott, can you help us out? Kathy, did you have an original motion before?
I did.
Okay, and can you repeat what that one was, if you don't mind?
It was maybe Scott can help me out. It was the 45 with his addition. So Scott, I don't know if you want to go through that again. Sorry.
Oh, it's okay. I just can pull it up on my. Does anyone want me to repeat what I read before, or are you good? Read it again.
The prefatory language.
Yeah.
I'm good with the prefatory language.
Okay. So, yeah, Mr. Chairman, we have a motion, second, and then my understanding of Supervisor Ard's amendment is that it sunset
January 31st, 2021, which essentially the end of January. There'll be a new administration in Washington. And my thoughts are that there are going to be some national orders coming down, which would significantly affect this ordinance or any ordinances like it.
Okay.
So then technically, again, correct me if I'm wrong, Scotty's is an amendment to the original motion. Am I correct on that?
That is correct.
Okay, so we've got an amendment on the floor, a motion to move it forward, and a second. All in favor of that, say aye.
Aye.
You're going to need to do a roll call vote on this. Isn't that correct, Scott? Because it is a resolution.
Scott?
You're taking a vote on the amendment, correct?
Oh, thank you, sir. I stand corrected.
It's an ordinance, not a resolution.
Thank you.
I don't believe you need to do unless there's doubt, do a division, but I think you can vote both on the amendment and the ordinance on a voice vote.
Thank you.
So this vote is on the amendment.
Yes,
Amendment.
basically, with the publication, the effectiveness of this ordinance would be a effective time period would be approximately 1 2/3 months till the end of January.
Yes.
I'm sorry, all in favor, say aye.
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 Aye. Opposed? Okay, the amendment moves forward. And now we're back on the original motion by Kathy.
Yep. Could I have a few more comments to make. I think that this revised ordinance language addresses the concerns that were raised in public comment over the hours that we've heard it. It specifies the types of orders that can be issued, face coverings and occupancy limits. It outlines a metric so that people can see how we're doing in our battle with COVID-19. Additionally, it has now this end date. It used to be that as Americans, we used to work together to solve problems. We come together in times of need. This health issue has needlessly been politicized. The virus doesn't care which party you support or who you are. It's real, it's here, and it's here with a vengeance. And really, the Palm decision forced us to act locally. And we know it's been difficult for everyone. People have lost jobs, businesses have gone under, parents are having to juggle their work with their kids' online school lessons. Mental illness and isolation are huge concerns, obviously. All that said, the best way, as others have said, to keep schools and businesses open is to follow public health's lead. We need this science-based, data-driven policy if we're going to have any chance of slowing the spread of this deadly disease. And I didn't run for county board to sit here on the sidelines during a pandemic. Decisions are difficult. People are going to yell and scream at you. That's part of our job as public servants. We are in the midst of the worst public health crisis we've ever seen. It's time for us to step up. I echo Scotty's statement. It's time for St. Croix County to step up and lead on these issues. Our hospitals, healthcare workers, and schools are looking to us for this leadership. And it's more than high time we pass this. So I hope that my other board members will join me in support.
Point of clarification, nowhere in this ordinance is it say we're going to remove people from their homes. Is that correct?
No, it does not. That was a reference to the previous draft, which I mean theoretically can happen under current law, but no, it doesn't state that, Supervisor Telejohn.
And I've had so many emails and comments saying that we should do something now instead of later because of the numbers rising, and yeah, it's scary out there. So
I'd like to state that basically what Scott had just said, the ordinance doesn't say that the public health officer would remove people from their homes or businesses. That's one of the things Scott did when he drafted the ordinance, was focus on clear language. We outlined in the FAQs on the St. Croix County website what are the things that were addressed. And so I encourage everyone to go up to the St. Croix County website. If you go to the St. Croix County website, on the top of the page, there's a COVID-19 information link that will take you to a page. It has all the information that we have as a county about COVID-19. Part of that is the proposed COVID-19 communicable disease ordinance. And within that, there are a whole host of FAQs that address a lot of the concerns that we've been hearing in emails, through public comment, and through the town hall, and as well as the survey.
Dr. McGinnis, did you have a comment?
I did. I wanted to draw the board's attention to 4105A, the last line, which says the local health officer may issue less restrictive orders based on local conditions and evidence of transmission. So I want to be clear that there's flexibility that looks like Scott has built into this to allow something that is less restrictive, more specific, and more targeted to those situations where transmission risk is significantly higher.
That's correct.
Natasha, you had a comment?
Yeah, I mean, I definitely echo many of the points that have been brought up. I do appreciate what Paulette's saying. Enforcement of this could be challenging, but we have to do something. We have to do something. And I don't know that it's just this, and I'm not talking about another ordinance, but I do think we need to be thinking about what else can we do to support public health and public health efforts. This alone, hopefully will be helpful, but I don't know that it will do all the work that we need to do alone. One additional thought that I have, which with the amendment maybe will not matter, but the Harvard model, the red zone or the red risk level that's referenced is the highest risk level there is. That's when it shows rampant community spread. It really makes me think that we may consider, the orange risk or the even yellow risk level as where the health officer would have the ability for those orders. Now, January, maybe, I'm guessing it's going to take a while to get to a lower risk level, but that's something maybe to think about as well. Red seems like, okay, we're already in it. We're already overwhelmed, and now we're just, we're behind the 8 ball, really. So I guess that's just one thing I wanted to put on the table too.
Could that be an amendment at this point, Scott, or is it?
Oh, sure.
Did you want to make an amendment, Natasha, or if you don't, I will.
Sure. I guess I don't know what risk level is appropriate. That's maybe the part that I would put out for discussion first. And Kelly, I don't know if you can speak to that.
Yeah, if you don't mind, we struggled with this a little bit in coming up with a decent metric. The state DHS has their own metrics as well. And we have begged them as local health, public health people to say, you guys need to add another risk category because everybody was in that highest risk category and we spent a lot of time there. Finally, I think DHS is going to announce they are adding another risk level category, and really all it does is shift the numbers around so the incidence case rates are let me think, higher, right? Or lower, Dr. McGinnis? Why can't I think? I'll tell you why I can't think. Because I'm tired. So needless to say, there are different models. We also had a little bit of discussion about, do we want to get ourselves into one specific model, as models may develop through this response. So that may be an option the board chooses to look at too, about going with one model versus another. We might have some more flexibility. I don't know. Does that make sense? I'm not articulating well at all.
Do you know what level DHS is considering, Kelly, for their?
Well, they're calling it a high critical level, and I don't have the statistics in which what that translates for like case incident. I could probably find that pretty darn quick.
If I may, Chairman Osnes, I think the attempt was to find something that was just very transparent, that was easy for the community to see and understand. I would be very surprised if we were to get down into the orange or yellow levels by the end of January, just unless something really amazing happens. I would be, I think, personally comfortable staying, let's just say where we're at. It will sundown at the end of January, and if it needs to be reintroduced with a different metric, because something better has come along or something that's clearer or more precise, or if it needs to be fine-tuned to involve lower case counts, which is green, orange, and yellow, are actually lower than the 25. And now we are, I think, if I'm from today, it was 96, it was 80 or 96, one of the two, but it was really high. So my suggestion would be just let's leave it like it is, see how it is at the end of January, and then make some further decisions from there.
I think that's a fair plan.
Yeah, sounds good.
Yeah, do you want to make a comment? We haven't heard from you yet.
Oh, I made a comment earlier, Dave, but yeah, I agree with, I think that what's on the table, I think we should move forward with that. Sounds good. Yeah.
Okay, Dr. McGinnis, you clicked in. You got anything more right now?
I do not.
Okay, so Scott, if you don't mind, after this long conversation, quick synopsis of exactly what Kathy's motion is, or unless Kathy wants to tell us one more time.
No, Scott's got the language in front of him. You're on mute, Scott.
Go ahead, Scott.
It was the ordinance as drafted with the prefatory language under 4105. Pull that up here. Pursuant to WISTAT 252.03, the local health officer has the duty to promptly take all measures necessary to prevent, suppress, and control the spread of communicable diseases. When the local health officer determines that orders are necessary to prevent, suppress, and control the spread of COVID-19, the local health officer is authorized to issue enforceable orders regarding face coverings and limiting public gatherings under the following circumstances. So then A and B will remain the same. And also there was an amendment that was passed that makes the sunset January 31, 2021. So that's what you're voting on. The ordinance as drafted with those changes.
Anyone else want to make a comment before we take a vote? Seeing none, all in favor of the motion, say aye.
Aye.
Aye. Opposed?
No.
Okay, motion carries. And Scott, where are we at now?
Can you clarify the vote for me, Chairman, what the vote was?
Pardon me, Ken?
Can you clarify what the vote was?
Do you want a division? Everybody can raise their hand that was in support of the motion. Okay, and everybody that was opposed?
right.
Does
So
that
this-
help you, Ken?
Yep, 7-1 vote. Thank you.
All right.
Dr. McGinnis.
Just a comment, Mr. Chairman, knowing that the county board does not meet until early December, knowing that our case counts are rising dramatically, having had prior communication from a couple of supervisors who said if things are bad, we could certainly call an emergency meeting of the St. Croix County Board to move this ahead in a prompt fashion. At least in my medical opinion, and as I look at the numbers, the situation is bad. That would not be an unreasonable step at this point in time. Obviously, I'm not in a position where I can make any kind of motion to that effect because that's outside my purview by quite a ways.
There is a petition process to schedule a meeting under Chapter 59. I think it's 5910. It requires a majority of the board. There may be another option that we could explore, but your point is well taken.
Okay. And Scott, what is our next move as we move forward now?
Well, the ordinance has been forwarded to the county board, so we will either wait for its December meeting, which I am informed could change based upon the recount and room availability, or in the event that the board decides to schedule a special meeting regarding this.
So when you refer to board in this case, is that the entire county board or is
That's
it?
correct, county board. Yep.
Thank you for clarifying.
There may be a recount that continues until December 1, which is the date of the regularly scheduled county board meeting.
Great. And with that, we'll move on to our next item, which is going to be a request for future agenda items. Seeing none, we'll let everybody know that our next board meeting will be. Sorry. Go ahead, Greg.
Well, what are we going to do about resources for Kelly? How are we going to address that as a committee?
Scott?
I would say that the HHS Director Bob Rort and I are working on that to the maximum extent that we have resources to do so.
It's nothing that as a committee we have to do or should do, or?
No, I really don't know anything additional that you could do to support us. If there was, I would definitely bring it back to you and ask for that approval.
Okay.
Do you have anything, Bob, that you want to ask for?
No, Ken, I think we're looking at every possibility in terms of funding and support that we can find. We do have some ideas, like Ken said, that we're working on to provide additional support or sustain the support that we currently have.
And Bob, do you have any other announcements or updates for us at all?
Well, Mr. Chair, I would like to just thank you and the entire Health and Human Services Board for your support. Not only for our public health division, but for my lights just went off, but for the entire department, because all of our divisions are feeling the impact of COVID-19, both on the workforce and on the populations that we're striving to help. Our purpose, the thing that our employees do every day, is focus on how to improve the well-being and the health of the residents of St. Croix County. That's what we focus on and will continue to focus on. But I do appreciate your support, your continued involvement and attention to matters like this. It means a lot to all of us. Thank you.
Well, and we thank you as well, sir. And while I've got you here, Bob, our agenda for the 18th coming up next week is just our normal business meeting. Am I correct on that? Do you want to kind of update us on what we're going to be doing?
Yes, Mr. Chair. Colleen and I were working on the agenda today to finalize it, and that should be coming out by Friday. There's a couple of presentations that we have planned, the financial review for October, and probably something else that I'm forgetting right now. But we'll get that agenda out by Friday so you all can see it.
Okay, very good, and thank you. A reminder to all, the ordinance will not be on the agenda. Obviously, it has been moved on to the county board. So our next meeting will be November 18th at 8 p.m. And as long as I've got everybody here, I would, if you don't mind, I would like to have another virtual Zoom meeting next Wednesday. I think with the direction we're going with the COVID and for the safety of staff and the board members and the general public, we'll do a Zoom meeting if that's okay. We'll open it up to public comment, but that will be calling in as we did tonight. So with that, our meeting is adjourned. Thank you, everyone.